Well, all right. Thank you, everyone. And I appreciate everyone being here. I hope you're having a good time in Las Vegas with the heat over 105 degrees, right? I missed a session earlier and lost $500 at the casino. I'm like, maybe I could save you some money, all right? So thank you for being here. In any event, I want to showcase to you what we're doing here and briefly introduce myself to you and our organization, but really look at a strategy that impacts healthcare in a big way, which is the spend associated with the cost of healthcare, the trillions of dollars. I'm going to start off by saying that that we are the provider of this technology we're going to showcase to you on the consumerization of healthcare via Walmart Health. So I'm going to show you a technology that's being applied right now to Walmart Health to expand to 4,000 to 5,000 locations across the country. With that said, I'm going to step back a little bit and give you a little bit of background on why this strategy appeals to Walmart and other healthcare institutions. We have signed on over 30 healthcare systems in this technology to impact their financial bottom line, attacking the rev cycle space. And 9 health systems alone signed up in the last 2.5 months using a strategy of automation. Quick background on us, we are healthcare providers by trade. So we actually ran hospitals, surgery centers, clinics. My brother's a neurosurgeon down in Texas, and the reason why I talk about that is that was one of the reasons for our successful transition into automation. In the last 10 years, we started developing our automation platform, and we kind of migrated away from the traditional platforms, the UiPath, et cetera, which are great products, but we really didn't want to create point solutions. We were trying to create an overall advanced automation, true artificial intelligence that learned what's happening on the front end to the back end to find savings for ourselves. It wasn't to create a product, it was to use a strategy to find savings. And that labor and time and money that was spent there revealed something to us that we could find 5, 10, 15% back to the bottom line of our health system. When that happened, we realized this is what everyone's reaching for, but why didn't they find it? Well, as AI was getting more popular in the industry, you started seeing healthcare institutions come up and really demand automation, because what they were doing was they were struggling with their finances, but trying to add a people process that was breaking on them because the complexities of the claims and the insurance demands were so great. That's obvious, right? And I want to make a statement here that is pretty plain, but I think people have to realize this. We were taking what we would perceive as a human process and trying to create an automation process with that, or computer process, when it's actually the opposite. This should have been a computer process to begin with, and we gave it to the humans to take over, right? To basically manage the myriads of rules and data that you just couldn't depend on the human mind to do that. Now, we're going to show you an automation as a strategy rather than a point solution. So over time, what happened was, as the demand grew, you saw all these companies come up, and there's a lot of noise out there where, hey, I have an automation for you that basically, here's a solution that fixes your piece of eligibility or your denial management or your payment posting. And if I keep buying these solutions through my departments, whether it's the revenue cycle department or whether it be the patient financial services department, we'll eventually get to some better outcomes in our rev cycle. Well, the bottom line is that you bought a bunch of widgets and you tried to connect them together, and they never communicated together to create that solution for you to find savings. We reflect back on that, and a lot of you I see are nodding their heads because you felt that journey. And what we want to describe here for you today is, if I could walk away and say that the description is to showcase to you a strategy of automation rather than a point solution, but you got to get to the advancement of it. But instead of me talking about it, what I'd like to do is show you what organizations like Walmart Health and the VA have done, by showing you a demonstration of what automation is going in through their systems. Walmart to expand to 4,000 to 5,000 locations across the country. The VA, with their complexities of eligibility in regards to who is required to get benefits from the VA. Are you are you directly active in the military? Are you a family of the military? Are you associated with the military in any form or fashion? We'd love to be able to help, but we have to use the help of automation. And I do want to tell you that the VA is just one of the most advanced technology organizations in the world that I've ever seen. A lot of people don't know that. Okay, so that description, and I know we don't have a lot of time, I want to showcase that these innovative organizations are really driving the edge of automation, and where the hospital systems right now are barely keeping afloat with 1 or 2% of $1 billion. Can you imagine that model? 1 or 2% of $1 billion that could flip on you and you could be out of business. Rural healthcare institutions that are out there doing about $150 million, and their debt covenants is in that range of 30, 60, 90-day receivables, they're struggling. They're going to close, right? It's sitting right there in their AR. When I see their AR creeping up over 30 days, and then I see 45 days, 30% over 45 days, I see denial rates at 9 to 10%. That means, what does that impact you as a patient? 1 out of 10 patients will not get their benefits that they deserve. Okay, so then our AI is able to deliver a better patient experience overall, get them to the services they need. Tell them, how many people know how much it's going to cost them even for their services when they walk in the door? This is what this automation does eventually, and gives you that end result, but it has to immediately impact the health institution first and foremost. So basically, there's $262 billion in medical claims. Roughly 9% were initially denied, meaning that billions of dollars of administrative costs, and I want to make sure I get my data right because I get challenged on that a lot. So there's $8.6 billion in appeals, just answering the insurance companies back and forth through a study by the American Hospital Association and Change Healthcare and also the Centers for Medicare and Medicaid. Sampling basically a population of about 3 million patients in the hospital system. And this data showcased that it cost $118 per claim, and that loss of $8.6 billion just to talk back and forth to the insurance company. Remember, this is not money that belongs to the insurance company or the provider. It's what we spend just to fight back and forth with each other. Is that incredible? So with that said, we are really looking to see what we can do to impact this. And the first and foremost is, before I even talk about automation, I like to show it to you. A lot of organizations can't show you this type of demonstration, but I'm going to show you what our organization has done to affect the job of basically what would look like a virtual human. So imagine you have a Jorie bot technology, we'll call it, that you're going to hire, but instead, you're going to train this technology to do the work of literally hundreds of people and go through the complexities of the rules that they have to comply with the insurances. Last but not least, before I play this, the reason why this is important. In the latest news, a large healthcare institution that starts with a C, I won't name the name, is being sued by the federal government for basically using algorithms to deny claims. Imagine that. There's millions of patients going through the insurances, and they need pre-authorization so that they can get treated for their disease state, whether it be cancer or whatever comorbidity they may have. And understanding that that would be reviewed by the insurance companies through various means of understanding that medical necessity, a doctor or nurse would review this in a timely manner so that this patient can get their care. But you think about it, there's millions of patients, so how many doctors can they employ or nurses can they? So you gotta know that there was technology involved, and this lawsuit that's coming out is really bringing this up to the media. And so with that said, why aren't we using technology on the provider side, right, to address this? This is the fight that we have, and here's a solution. So I'm gonna go ahead and play this and then showcase it, and I think it'll kind of reveal what advanced automation could do to impact the finances of healthcare institutions. So what we're going to show here is Derek loads up that video. This is a video of virtual human. that basically will be voiced over by our chief technology officer, and it takes the place of a person that is doing the administrative burden of handling these claims. So you're going to see it going in and out of the portals and actually affect its job and run literally hundreds and hundreds of data points and understand to take action. That's the key. So it takes action. It takes action, like, for example, if a denial is made because it requires authorization, instead of throwing that back to a administrator to address that denial, it'll actually submit that to the insurance company and appeal that denial and write the appeal letter automatically. On top of that, its ability to take action on medical necessity issues, like understand the notes and understand that the libraries, like an ACDF, hey, that's an anterior cervical disc fusion, that's a neck surgery. It'll know that and read the notes and look back and say it required a comorbidity like smoking or obesity in order for it to warrant an overnight stay at the hospital for you to get reimbursed. You might miss, as a human, you might miss the fact that there was this patient was coded for a percutaneous procedure, a small procedure, versus an open procedure, and that's a $7,000 miss, but your finance team showed 100% reimbursement, all right? The bots could also look back in time 360 days to look at why why your claims weren't paid accordingly. So obviously what we did here is we ran a video that showcased our bot working through the system. In reality, what this bot does is plugs into 1,400 insurances directly through its API feeds. What does that mean? Well, what your staff is going in through Waystar or Availity to try to check the insurance benefits. These are your benefits. These are benefits that you have in regards to your insurance cards, et cetera. Now the bot's going to do a thorough capture of that. And when you have a human process, it does that every 3 days, or you task it at a human every 3 days. But now it will do it automatically 24/7. And on top of that, it'll do processes like within your organization, you might have humans in the surgery center setting or in the surgical setting, and you have a patient walk in the door and go straight over to surgery, and you're scrambling to get a nurse to do the eligibility on that. That's not the best use of a nurse. You know, obviously the bot's rules can encompass immediately a patient that walked in the door, pick up that eligibility and run that task. So the idea that you use a strategy rather than a point solution like this to affect its job is critical to finding money. And what are we finding? We're finding 5, 10, 15%. And so when I discuss this to the healthcare institutions, who am I speaking with? I'm speaking with the CEO, CFO, and CIO. Why? Because when I talk about strategy, I don't want to bring up hey, I have a bot, a tool chest that I could provide you, and this tool could work for you. There's many vendors that can provide that. But what I want to try to educate is, are you utilizing a strategy that grows with your organization that continues to improve over time? And use a strategy to transform the way you bill and collect today, instead of from automation, where you're piecemeal it by 10 different products, and then it breaks over time because there's always change in healthcare, right? So the ability to transform that into something that continually adapts is really key, and that's where our automation lies today. So, all right, I'll wait for them to try to get that on the demo there, because I think it's pretty compelling to see an automation actually working in place. But while we're waiting, I'm happy to answer any questions in regards to the automation. So, is there anyone up there? Yeah, yes, sir. Yeah, absolutely. So the question was that you've got insurance companies using bots, and then you're working on the provider side using bots. Wouldn't it be better if you worked for both, right? So the short answer is yes. I would love to see the collaboration where we tighten up the gap between insurance and providers 100%. That fight will never work. And understanding that you're looking at a fee-for-service model that will eventually go away to a patient population risk factor model, right? Well, why am I not talking about that? Because when I do talk about that, and we have that scope of work with some of our clients, the short answer is no one could trigger those events yet. And so what I do is I put out the fire. You have to build the foundation first of a steady a healthy financial bottom line. From that point forward, you could build an automation that really encompasses population health. How does that look like? Well, every patient has a code. Every patient has a note associated with it. Every patient has a price attached to that code. When you combine it all together, that's used to file a claim, right? That's all we could do when you're doing manual process. But when you're using advanced AI, you could go back in time. You could go back in time and actually find those diseases that are required. All right, they've got the demo going. I'm going to showcase it to you right now.
Hi, my name is Jatin, and I basically heads the global technology and process excellence for Jorie. Uh, we have been instrumental in implementing our AI-based bot across the revenue cycle services, including the accounts receivable, which is one of the most critical process for any of the RCM business. So what I'll do today, I wanted to demonstrate an AR bot which enables you to visualize how the bot will go into the different insurance portal, access the EOBs, access the denials, understand, comprehend the way your AR team does, and then go back into the practice management system and take the actions like creating an appeal letter, doing the eligibility checks, and also taking the actions to resolve that particular claim. So what I'll do is I'll run this bot for you, and anything that you see on my screen after I click this particular bot is something that will be done by the system itself. So let me trigger this bot. In next few seconds, the bot will go back and trigger, wherein the bot will go back and log in into the Waystar, which is our clearinghouse for this demo. So the bot has started executing. The bot is logging into the Waystar application, which is a clearinghouse. And while the system is getting logged in, this bot technology is agnostic to any of your EHR, EPM system, and so on and so forth. With that being said, bot has gone into the practice for which the claim status has to be checked, has hit on claims, and on the left hand side, you will see that the bot has started entering the first patient information. Now, bot will go back and open the EOB. Once the EOB is open, the bot will comprehend, analyze, and memorize what the claim is all about, what the status is all about, so that it can take the actions later on when it goes into the practice management system. Within 3 to 5 seconds, the bot goes back and analyze that particular claim. And even before I completed my statement, the bot has already gone into the second claim within the system. This is something that the bot will keep on doing for you, wherein we have typically seen about 55 to 60 claims in an hour is what bot can do, which means versus I would say 60 claims in a day that your AR team would have done it as well. So that's the first efficiency that you can gain from this bot technology. The second one is predominantly on increasing your overall collections by basically working on to the denials in real time, sending the appeals if required to the insurance without any human intervention, working on the denials like coordination of benefits, taking it to the next level of resolution either by flipping it to the patient or billing it to the secondary insurance. So in few minutes, the bot goes back and cover up the entire stuff, and it also helps you to reduce your AR days, because the moment payment comes in, the bot can go back and post the payment back into the practice management system as well. So these are the four claims which we are using for this demo, wherein be it denial, be it payments, the bot can quickly bifurcate them into two different segments, that's payment versus denial. Once that's been done, the bot will now go back into the practice management system, which is eClinical Works for now. But we have been instrumental in implementing this technology across Athena, Cerner, Epic, ECW, HealthPack, NextGen, IDXG Centricity, to name few of them for you. Now, this is where our bot utilizes the computer vision technology, which enables our bot to be more stable, because till the time the system is completely loaded, the bot will not move on to the next step. And at the same time, the way bot has analyzed the EOBs were using our NLP technology, the natural language processing, and our homegrown taxonomies that we have built up over the last few years so that the bot can understand the lingo and comprehend those claims as well. So now the system is loaded, bot is going into the claims, and now the bot will go back and enter the first claim information. Will open the claim for which, or the patient for which the claim status was being checked. Now the bot is going and recording or mentioning the status of the claim which it has captured. So you might see now how smartly the bot has captured the allowed amount, paid amount, deductible, co-insurance, write-off amount, check number, check date, without any human intervention. And that's how the beauty of this bot is. So all these comprehensions is done by the NLP engine and the taxonomies that we have built up. And in next few claims, you will see that the bot can not only capture the payment information, but in case the payment comes in, the bot can go back and post the payments in real time as well, helping you to reduce your AR days and also take the resolutions if needed, irrespective of the line items which have been there in the bot or into the particular claim. The bot can go back and quickly analyze them, comprehend them, and this is where we can go back and integrate your own standard operating procedures, which means about 65-70% of the development is already completed for based on our efforts that we have put up in the last few years. And all we have to do is come back, customize your SOPs, and bring it on to the live environment. So now in this claim, you might see that the E&M code is denied for coordination of benefits, and also the CPT code 80307 is being denied for the same. So you might see that whether it's one line item, one CPT, or multiple line items, bot is smart enough to understand and comprehend the same thing. As far as the security of the bot is concerned, we typically follow a Red Queen security methodology, which means data in motion or data at rest is completely encrypted. Anything that bot captures as a part of the overall denial management, bot flushes out its memory once it's done, once it has completed the actions into the system, so that the PHI is not being compromised. And also once it's done, the bot will go back and log out from all the systems that were being utilized as a part of this overall claim status process. So now you will see in next few seconds, the bot is now logging off from the first application, which is Waystar, now logging out from the eClinical Works as well, so that none of the PHI gets compromised. And it will also shut down those applications. So now if you'll see, everything is being completed, and the bot has also created the report, generated the report in the output folder for us, which can be emailed back to your billing manager or your AR manager, which shows you the entire report of what all claims were being processed and what all denials were being captured by the bot. Typically, a bot can manage about 60% of the volume without any human intervention, and rest 40% can be flagged out as an exceptions, as a throughout, which requires human intervention. For example, the claim is denied for CO16, which is additional information required. However, there is no remark code onto the EOB. But in case there is a remark code, like for example N371, which is typically for the medical records, the bot can fetch the medical records, create the docket, fax it to the insurance, or in case of Noridian or Optums of the world, bot can go back and upload those documents onto their folder as well. So this is how sophisticated our bots are, which enable you to go back and manage your revenue cycle services, which is agnostic to any technology, any platform, and at the same time creates a hybrid model for you wherein heavy lifting can be done by the bot, and rest, which is the leftovers or a critical claims which requires human intervention, can be flagged out easily. With that being said, I'll give it a pause and pick up any questions that you may have. Thank you.
What I'm going to showcase to you here really quick is what happens when we impact the health system with this type of technology. So this is an example, we'll call him Dr. G. Dr. G is a live client of ours. They're hitting about a 9% denial rate in the front end of eligibility. And you can see, if you look at the the third top bullet point there, the patient's billed. He's seeing about 4,000 patients a month. If you go 2 tiles down, he's requiring 12 people to just address those denials. When we used the bot technology, it only required about 3 people. The cost savings was about $57,000 or $58,000 a month, but we really weren't here just for the labor arbitrage model. We are looking at the middle graph in blue, that vertical line there in that line graph there showcases where we started at about 9%, and we dropped it all the way down several months down to 3%. The overall savings was $694,000, but really the truly compelling document is coming from what this is really showcasing. It's a 66% drop in denials, all right? This only can be done with advanced technology, taking action on several levels, and then maintaining those rules so that is consistent without having to hire any more people or train. Can you imagine this in a rural hospital setting where you just can't even get people, but now having like 100 people equivalent doing this type of work on this level? We took this client that was getting denial rates or AR days that are climbing up over 45, and we got them down to 18 days. This denial rate was a 3%, again, a 22% change in AR days, 9% going all the way down to 3%. So that is our technology in a nutshell, and it just starts there, and it continues to learn and improve. Now it does complex tasks like short balances. You can't chase pay $2 for a person to chase $1. It doesn't make sense. The health systems are going, well, they're asking the claims department to go, can you at least touch these claims? We'll count how many touches you do. That's not collecting, folks. So at the end of the day, if you have this technology was meant to be delivered to enhance your rev cycle, to financially impact your bottom line. The only way you can get there is utilizing a strategy. If you buy point solutions across the board, you're not going to get there. All right, point solutions being, hey, let's do one task or another task, but never strategic like this to impact the bottom line. Well, we don't have any more time for Q&A, but I'm happy to answer any questions afterwards. Please come down to my booth, booth 107. We have the big blow-up bot over there. Happy to talk to you in person for any questions that you may have. Engage us at joriehc.com and see what we're doing to impact the rural hospitals of America. We do have the national president of the Rural Hospital Association that works with our organization to be able to identify the needs that are out there to prevent some of these hospitals from closing. Thanks all for your time.